Hey everyone! Today we're going to talk about something you might not have ever thought about. You get a scan for one thing, but the doctors end up finding something totally unexpected somewhere else. Let's get into it.
So, picture this. You go in for a chest scan, a CT scan, maybe to check on your heart or your lungs. Pretty standard stuff. But then the report comes back, and yeah, it talks about your lungs, but it also mentions a finding in your breast. What happens then? It's a bit of a curveball, right?
Now, you might think this is a super rare, one-in-a-million kind of thing, but it's not. Not at all. We're talking up to 8% of all chest CT scans showing some kind of incidental breast finding. That means radiologists see this sort of thing all the time.
So how does this even happen? Let's dive into our first section, an unexpected finding. We're going to break down how a scan that's supposed to be looking at your chest ends up peeking at the breast and what radiologists are actually on the lookout for when it does.
Okay, so a chest CT is this amazing tool, right? It gives doctors these super detailed slice-by-slice images of your chest. The main characters here are obviously the lungs, the heart, the big blood vessels, but the breast tissue is right there in the neighborhood. It's not the star of the show, but it's definitely in the picture.
All right, so to make sense of that picture, a radiologist needs a map, and that's what our second section is all about, reading the anatomy. Think of this as the essential guide they use to navigate what they're seeing on that scan.
If we look at a mammogram like this one, you can see the basic parts. You've got fatty tissue, which looks darker, and then you have what's called fibroglandular tissue. That's the working part of the breast, the ducts and lobes. It's denser, so it shows up as white. And the mix of these two is totally unique to each person, kind of like a fingerprint.
Now this here is the lymphatic system. You can think of it as the body's drainage network. And this is key. A huge chunk of the breast's lymphatic fluid, we're talking up to 90%, drains right into the lymph nodes in the armpit. That's exactly why radiologists pay super close attention to these nodes on a chest scan. Any changes there could be a big clue about what's going on in the breast.
And that brings us to a really important idea, breast density. All it means is the ratio of that dense white tissue to the less dense, darker, fatty tissue. I love this analogy. Imagine trying to spot a tiny white pebble. Is it easier to find in a sparse, sandy garden or in a dense, overgrown forest? Well, it's the same idea here. The denser the forest, or the tissue, the trickier it can be to spot something unusual.
And this isn't just some interesting factoid. Breast density is a big deal. It's actually a known risk factor for breast cancer. And that's why, as you can see on this map, 38 states have laws that require doctors to tell patients if they have dense breasts. It's all about empowering you to have that conversation about what screening options are best.
Okay, so the radiologist has spotted something. Now what? Well, now the real detective work begins. In Section 3, we're going to look at how they sort through the evidence, figuring out if a finding is probably harmless or if it's something that really needs a closer look.
This table is basically the radiologist's decoder ring. They look at a mass and break it down by its features. Is the shape nice and round or oval? That's a good sign. It points towards something benign. Or is it irregular with these spiky edges? That's a bit more concerning. And maybe the biggest question, has it been there for years, totally stable, or is it brand new and growing? Every single one of these clues helps them build a case.
But, and this is probably the most important thing to remember, a CT scan alone can't give a final answer. It gives clues, really important clues, but it's just not designed for a super detailed breast exam. You gotta think of it as the first chapter of the story, not the final page.
So let's see how this all plays out with some real examples. In our next section, we're going to decode a few specific findings. We'll see how radiologists take that first clue from a CT scan and use other tools to get to a clear, confident answer.
Okay, here's a perfect case study. On the left, that's the chest CT. See that smooth, oval-shaped mass? Remember our decoder ring? Those are good, reassuring features. But to be 100% sure, they did a follow-up ultrasound, which you see on the right. And yep, it confirmed this was a benign fibroadenoma. Investigation over, case closed.
But now let's look at a different story. The CT on the left showed a mass with really irregular, kind of spiky margins. That's a major red flag. So that finding triggered a PET scan, which you see on the right. PET scans basically light up areas where cells are super active. And, well, you can see that bright spot. It confirmed this was highly suspicious, and a biopsy later showed it was a carcinoma.
And this right here, this is the golden rule of the whole process. If a mass is new, or if it's bigger than it was on a previous scan, it has to be investigated further. Period. It doesn't matter how nice or benign it might look on that initial CT. Any change over time is the #1 piece of evidence, and it absolutely has to be followed up on.
So let's say this happens to you or someone you know. It can be scary, right? But there's a very clear path forward. In our final section, we're going to walk through that path to clarity. It's not a big, scary mystery. It's a logical, step-by-step process designed to get you an answer.
Here's the playbook. It's pretty standard. First things first, the radiologist becomes a historian. They hunt down any old scans you have to see if this thing is new or old news. If it's been there for years without changing, that's incredibly reassuring. Next, they'll correlate that with a physical exam. And finally, putting all that evidence together, they'll recommend the best tool for the next step. Usually that's a diagnostic mammogram or an ultrasound to get a really good, definitive look.
So here's the bottom line. Finding something unexpected on a chest scan is not a diagnosis. It's just the start of a very clear, very well-established path. It's a question mark that modern medicine is really, really good at turning into a period. Thanks for tuning in.